name is Dr. James Choo with Pain Consultants of East Tennessee. This is Jim Breidenstein, and he's with Adhere Plus, or the CEO of Adhere Plus, and he's coming all the way from Buffalo, New York to talk with us about his platform.
Sunny Buffalo, New York.
Sunny Buffalo. All right, so Jim, we in the pain medicine world, we see these patients that come through, and then they go home. What is missing when they leave from the clinic and they go home?
Well, you probably know the answer since we've been working together for about a year and a half now, but what we feel is missing when a patient leaves your office is the connectivity that they get when they're with your amazing staff. They're at home, they may be suffering some symptoms, they may be in pain, and they'd like to have someone to converse with or stay connected to your care team to give them additional guidance. I mean, we're firm believers that connecting the patients to the care team when they're not sitting in front of you is what we strive to do.
Yeah, that's great. And so, we come up with a good treatment plan here. How does it fail sometime?
Yeah, you're right. You come up with this great plan, and it's tricky for the patients, right? They're on their own. Sometimes the medication remedies are complex. Sometimes they're not feeling well. But what really is, we strive to have that adherence of your great plan. And by keeping the patients connected from our smartphone-enabled technology, and I'm sure we'll get into it, we help them stay on course with the great plan and trajectory that your team puts them on.
Right. So you're basically, we're trying to have this continuity from clinic to home, and your platform may help with that. So you have seen major shifts in pain medicine, or not just in pain medicine, just in medicine in general.
Indeed.
And so what do healthcare leaders miss during these big shifts in innovations?
The shift in innovation it's a progress. It's a progress for you and your team to embrace a new technology. And thank you for being a thought leader and embracing this new state-of-the-art monitoring technique. It's really great to work with folks like you and your team. But it's a process for the patients too. How do we now begin to adapt a new modality in treatment? So as a healthcare executive, we often have to stop and think about all elements, right? The payer, the insurance company, how does it factor in there? How does it factor in for the provider and the team, your great team? And also, and most importantly, I think we both would agree, is how does it factor in for the patients? Can we make their care journey better? And we sure as heck better with our technology. We might not be around too long, but as you and I both agree, if we tackle that element and all of those elements together with a technology or innovation, I think we're on a great path forward.
That's great. And so you were a part of Kyphon at one point in time.
I was,
right?
I was.
And when Medtronics had acquired Kyphon for $4 billion, is that right?
A little more,
yeah,
but
a little bit more and some
Who's
change.
counting? Who's counting?
Yeah. What did that teach you about how medical innovations work? That must have been a massive opportunity for growth and learning.
What a great question. You're making me think back a few years, but Kyphon was wonderful. It all started with some amazing leadership at the helm, of course, and then the innovation was so unique and game-changing that it allowed us to do something different. But again, I want to come back to the crux of my story and who I am as a leader is we want to do what's better for the patient. And Kyphon balloon kyphoplasty helped patients that were in terrible, terrible pain, as you know.
Yes.
And oddly enough, I think I saw one on your schedule today.
That's right.
That's all. Maybe I'll peek my head in and watch. But it helped patients that were in terrible, intractable pain. And because they were in so much pain, they were bedridden. And that led to what we called the downward spiral of care. They'd get pneumonia from laying on their back too long. They maybe get some ulcers and things, if you will. And we were able to change the dynamic of that, where within 24 hours, we had these patients up and mobile in just 24 hours. So it was wonderful from that perspective. And of course, now it's a gold standard in care, I believe, right?
Absolutely, yeah. And so, I'm not Dr. Choo right now. I'm a patient.
Yeah, sure.
So explain Adhere Plus to me.
Great, yeah. This is my easy discussions.
Yeah.
We care so much about you in your journey, whether it's addiction or recovery or chronic pain in this case. We care so much about you. We want to do the very best we can. And we know that monitoring you and with you in your symptomology while you're not sitting in front of us, because by the way, the insurance carriers, we can only see you once every 28, 30 days-ish, right?
Right.
So we want to, help you when you're sitting at home watching TV or you're at the Little League watching one of your grandchildren. We want to help you if there's any side effects, if there's any issues with your medication, or if you have any questions about just your good old-fashioned treatment plan. Adhere Plus ties us all together so we can provide the best possible way for you on your recovery journey.
And so from my perspective, when we see a patient maybe fall or injure themselves, they have a new problem, what we're trying to see is that patient contacts us, we're able to address it with our team, and to your point, we are decreasing the amount of ED visits, ambulance rides, hospitalizations, and unnecessary appointments. And so we talked a little bit about monitoring, okay? And so we always think about Big Brother, maybe compliance, right? And so what we see from our perspective is that if we look at what your platform is doing and compliance with Medicare and the insurances on how to do remote therapeutic monitoring, seems like to me the compliance is tight. Is that from your perspective?
Yeah, we're actually a compliance platform, and the reason we feel so strongly about that is we want to give you as a provider, a business owner, quite frankly, information, right? Knowledge is power and information. And we want to give you that information in case you are ever audited or anyone ever asks any questions about the treatment plan or methodology. At a click of a button, our system will generate for you all of the information that you need to support any questions or any financial claims if it's from the reimbursement side of the house. So we want to provide you all in any medical specialty a layer of compliance.
And it's very, very, very important for the confidence of the treating team to feel like they're secure. Is healthcare moving permanently towards the home?
Absolutely. In my opinion, absolutely. If we think about just the cost structure, think about the accessibility issues, think about the baby boomers aging out and the troubles with transportation, et cetera, and quite frankly, just the advancements in technology are now allowing things like Adhere Plus to be released and pushed out to the masses, all by way of automation. I think absolutely the technology is here to stay for sure. And as you know, the reimbursement societies are supporting at-home care and remote care. Even in fact, as of January, CMS has expanded once again the reimbursement codes, making it more applicable to not only a broader amount of specialties, but also applying to a broader range of patients based upon monthly participation. So absolutely yes for me.
Yeah, and so if you're a healthcare leader with long range of experience, and as a CEO, you got to predict where the future is going to be, right?
Yeah.
What do you see for patients in 5 years? Where do you think things are going?
Yeah, great question. I wish I had a crystal ball to get this 100% right. To me, it's all about the era of connectivity. It's all about the era about data. One of the great things about it here is, as we reach out to the patients every day, literally every day, we ask them 3 quick questions. It takes about 15-ish seconds for the patients to answer and send that information back, those answers back through automation into our dashboard. All of that is collected. We call that electronic patient reported outcomes data, or ePROs. ePROs are very, very valuable because it's the only way that you can get information on a daily basis directly from the patients. That information is really important, number one, from a clinical perspective, but also from a financial perspective. Big data, we often refer to it as, big data is being amassed by Adhere Plus at an incredible speed, where we can turn that information into things that further benefit the payers, the providers, and the healthcare system, for example.
And all the numbers are being tracked in big data sets. You've got to have something that collects that information.
That's right.
And so what happens if clinics don't do this and they fall behind?
Yeah, that's a great question. I as a patient, we have options nowadays, right? And if I went to your great practice and you were offering a service like this, and I went to the next organization down the road, for example, and they did not have that, I would feel like you're so much further ahead. You care so much about the patient interaction and the patient journey. You're providing state-of-the-art advancements in medicine that others may not be. So I would, listen, people can do what they want, but I would love to have my providers care about me enough to stay connected when I'm not sitting in front of them.
That's right. So if anyone is watching this and they're feeling like they're stuck with their pain or maybe the chronic conditions, what's the message that you would relay to them?
Well, the first thing I would say is call you. That's the first thing I would do. But no, I would say that, you know, there are different modalities that can help them, different things that we can do that will give them access or reassurance on their journey. And then, of course, you know, with your great team utilizing our technology and just the great service you folks provide in general, you know, I think that would be a great place to start.
Well, Jim, thank you so much for spending your time with
of
us, coming all the way from sunny Buffalo, New York to not so sunny East Tennessee right now. Your platform has opened a lot of comfort and communication and a lot of support that our patients feel, a lot of granular detail and data that we're able to collect on patients in somewhat real time. And so it's transforming what we're doing, and it's going to transform the country. So we appreciate what you guys are doing. You're a great team.
Thank you.
And thank you for spending your time with us.
Yeah, thank you. Keep up the great work.
Appreciate it.
All right.
All right.